first of all, this is just, you have no idea how awesome this is for me. I attended a women's college, and I'm all about women in tech and science, and really growing up at a women's college, it was all about how can we help support each other. And it's events like this that I think can bring people together to start the conversations. And by the way, I'm really glad there's a lot of men here as well, because it takes a village. And I think diversity is power, especially when it comes to leading. I think that, the more diverse perspectives you can bring into an office, the better off you'll be. So there's a place for everybody at the table, and I'm so thrilled that there's so many women here tonight. So I started my career at Arthur Andersen Accenture doing systems integration for healthcare companies across really the Western U.S. And then over the year, and I did not have and still do not have any kind of IT degree at all. And I was talking to somebody else earlier tonight about degrees and certifications and how difficult it is to find a job if you don't have the specific things they're asking for. Sorry, Rebecca, I'm going a little off script. But these are this is important. This is happening right now. So I had a dual liberal arts degree, and I started doing systems integration. And the key was, are you a fast learner? If I put something in front of you, how quickly can you learn it? And so I would say that's one thing that I've noticed in the recruiting and talent acquisition process, that I've seen women kind of coming in and saying, you know what, we need to bring diversity into this organization, and how do we do that proactively? And secondly, let's make sure that we're looking for the complete, more than just what we're seeing on a piece of paper, and that person's attitude towards learning and agility becomes more and more important, I think, the more sophisticated and complex healthcare is. So right now, my role is Chief Growth Officer at SnoreQuest Laboratories. When I started, I didn't know a thing about diagnostics either. And so it's really, I'd spent my time at CVS Health prior to that. And so it's really about that love of learning. And in my current role, I've got responsibility for about 10,000 provider relationships here throughout the state. So we do a lot of work with, as you can imagine, all kinds of specialists. And then I also have responsibility for our entire patient experience. So we have the opportunity to serve about 26,000 individual patients every day here in the state of Arizona. I also have responsibility for our managed care contracts, so that's how we get reimbursed. And I also have responsibility for all of our patient services division. So if you go out and get a blood draw, you go into a lab to get your blood drawn. We have about 78 of those throughout the state, so I have responsibility for that and innovation. I lead up our Innovation Center of Excellence for our integrated system, which is SnoreQuest and Banner Health. So I will turn it back over to you, Rebecca.
Thank you so much. Yes, there's a lot that you have done, so it's not going to be short. How about you, Megan? So Megan Stilling from Nerdery.
Hi, welcome everyone. I'm glad you're able to make it out and enjoy the wonderful space. I'm from Minneapolis, so I'm also enjoying your wonderful weather. So thanks for having the event here in November and not at home. So I love coming down here. I'm the Chief Digital Officer for Nerdery, so very excited to get to know everybody from each of our offices, as well as our nerds across the country. I have responsibility for our strategy teams, our technology team, and our delivery team, and all the great work that we deliver for our clients. So exciting to see some wonderful team members up here on the flip chart. I love watching our women in technology kind of float up here, so that's been wonderful. So I took a bit of a different path. I went to a very male-centric engineering university, so I tend to spend my time as the female in the room. So this is also a very fun room to be in. And over that time, it's always been about, how do you make your impact? How do you get comfortable, kind of show up, be you, and be confident in what you've done? And I love the parallel to, it's about tying experiences to what folks are looking for versus maybe purity or directive experience, right? We all, talking about patient interaction and customer interaction, we are all patients and customers of various forms, functions, and processes. And I think if you can contextualize why you're there, and how you can tie it to the experience that you're trying to plan out, it really, really brings that depth of honesty and integrity into the situation, and you can really be authentic in what you're recommending, what you're looking and parallel what you've done to the challenge, right? If you've planned an event, you can plan a project, right? So it's how do you break those down? How do you tie those parallels, and how do you tell those stories? I think that could be really important. Yeah, so welcome.
Yeah, thank you, Megan. That's so true. Drawing parallels from our own personal experience are super important. Oh,
Sorry, I gotta grab the mic.
Yeah. Is it on? Does it work?
Can you guys hear me?
Okay. All right. So Michelle, bonjour. Go ahead.
Hi, everyone. Thank you for having me. It's wonderful to see all you guys here and to be back in person and doing these events and actually socializing and exchanging ideas. I am the Director of Consumer Engagement over at STC Health. We're right downtown Phoenix. Been around for 33 years. And so in my industry, it's really exciting because we work with a lot of public health departments and pharmacies. And that's traditionally been male-dominated fields. And so it's really exciting to see out there, when I'm out there talking to pharmacies, I see more pharmacy schools and more management opportunities for women. And they are really increasing. I see women techs and women pharmacists all the time. And so it's really exciting to see the amount of effort that's really changed from the male side to the female side and working together. So yes, that comment of the men being here as well, I think that's very important. But it's exciting to see that there's a lot of women leading the charge in that too. So in the American Pharmacy Association, they just recently had Sandra Leal, who was voted the president, and she's also a minority. So I think she's really representing a lot of what all of us represent in all manners of aspects. So at STC, I'm really excited to say that we have 48% females, and of that, 33% of those are in the engineering department. So very excited to have that perspective as well.
And I think for some of us, not everybody knows what STC Health does. So maybe if you could give them just a quick little tidbit, because it's so important right now with the pandemic that we're in the middle of.
Yeah, it's very interesting. So STC Health is a vaccine intelligence company. And so we provide a lot of data and insights to pharmacists, to these state health departments, which go all the way up to the CDC. So within the systems, when a vaccine is reported, those go through our systems for those that have our systems. So any patient management systems, anything like that. Once it's submitted through that, then it automatically gets sent to the state health department, which goes up to the CDC. So with that includes, bi-directional exchange, right? So if a pharmacy is looking to see whether or not, if you walked into CVS and you're wondering whether or not you got your zoster vaccine, they can look it up, say, yes, you have, you don't need it today, or no, you haven't, and then they can go ahead and provide that information or give the shot back there. So,
yeah, super important right now, especially. I was just in Canada and I got asked for my vaccination record no less than 35 times.
Yeah, sure.
In a day. Like it was,
up there.
Yes, very, very strict. Well, thank you all for being here today. I'm so excited to be able to share your insights for you to be able to share your insights with the attendees here today. Let's talk for a minute about digital accessibility and why it's so important, especially, given these last 18, 24 months that we've been going through. What does digital accessibility mean to your organization, and what are some of the things you're doing to address it? So I'll start with Christina, and then we'll work our way over.
So it's interesting. If we take a slice of the data of the individuals that most frequent StoneRquest Laboratory, a lot of them are going to be 40 to probably 55, and there's a big chunk that's 55 plus. And so it's really interesting. We have, of course, doubled down in the digital space. We've got a really fantastic patient portal. There's always work to be done there. That never ends. But kind of interesting is we still have folks that really just still want to call in and make their appointment that way. And so one of the things that I've been touting and talking about is how do we engage however you want to label the age group, but folks that aren't necessarily digitally savvy, how do we engage them? How do we educate them? How do we reach out to the nonprofits and others out there that can help folks get comfortable with the technology? Because I see that as a barrier. I mean, and we've got more folks that now want to be in their homes, thanks to COVID. They don't feel safe going out in the public, so they've kind of got to move to digital. But what are we doing to help the aging get comfortable with that? So I think that's kind of incumbent on all of us to work together as a community to figure that out. But we've definitely, we've got standing meetings, weekly standing meetings to talk about the voice of the customer and how that feeds into our portal development. So it's really an outside-in philosophy. We can get a bunch of really smart people in a room pontificating about what we think they need, but at the end of the day, in my organization, it's all about the voice of the customer. So it's really leaning in there and using that to map out what our plan's going to be for our digital strategy.
Yeah, I think that's a great point. When we talk about accessibility, quite frequently we talk about a common set of disabilities that sometimes is sight or use, but I think the aging population component of this is very important too, right? So how do we make, it's about inclusion, it's about access, because you don't want to isolate customers who could possibly customers because they can't engage with your digital means, that, as well as kind of the compliance components and the cost saving components, and they're there, right? They're a reality because a lot of these projects tend to be coming from a legal or a compliance constraint. But as you think about the voice of the customer, you think about the experience, and you think about that aging population, it really does expand the use and the need for the accessibility tools, accessible design, accessible engineering, and different pieces around there. We were talking about this a little bit in some pockets, and I know we've got folks here who, if you want to talk about it more, definitely can have time afterwards, because what that means to different organizations. I know somebody's going through a whole website reorg to take a look at how accessibility is going to impact that. So it's impacting our daily life, both at work and then possibly, and we talk about things like bright. It's rather sunny here, so there's some, accessible components about how you can see in contrast and when you're using devices. So there's a whole number of impacts. That if you think about the full life of your customer using your digital products, there's a number of different benefits that it can provide.
Thanks, Megan. And how about at STC Health? I mean, you released My IR. You've done a lot in your company to try to create more access to that kind of vaccination information.
Yeah, and I think on top of all the accessibility, I think the easy to use for the consumer, right? So that one product that we have, MyR, which allows you to access your immunization records online or through on a phone, any device really, it has to be user-friendly, right? So if we have more women in technology who are helping design these things, I mean, that product is over 50%, we know, use that are females. So how do we create a product? How do we get that customer feedback back? One is by the chatbot. One is working with our support teams. Where are they getting those hang-ups when they're working through the workflow? Why are they not able to finish the process? Or, why are they not logging back in? And so I think having that feedback consistently is really important, and it helps us design our products better. So it is challenging when you just think of what we think, and then often we get those feedbacks and we're like, oh, that's not at all what they need, So it's interesting and definitely fun to be a part of, because it's changing all the time, I feel like.
Well, I don't know about you, but with 3 kids that are doing sports and stuff, and everybody wants the vaccination record, and the nurse is calling, where's their latest vaccination record? It's so nice to have a place where it's just all there.
Yes. And back to that point where we have a huge population, a lot of parents or grandparents are looking for these records and they don't know what to do. They want to call, so calling in, and we have a whole separate process for them. So yeah, the idea is to simplify it, but sometimes, that gets tricky, and depending on who you're reaching out to and what they're doing.
Oh yeah, it's super challenging. Let's talk a little bit about what you're doing to really familiarize yourself with the patient experience. Like, what are some of those tactical things that you do to see what's working, what's not? And I'll start this time with you, Michelle.
Yeah, so just kind of stemming off of that, I mean, we get a lot of information back from our chatbot. We've known what part of our platform are they getting stuck on, and then where is it just overflooding and they're not even trying. They just want to get help support right away. So we have that. We host, feedback forms we have that we send out. We have consumer calls, and that's always interesting. You never know what you're going to get. But also, we have monthly meetings and we talk through some of these pieces and figure out, where in the process is it getting hung up. And I think just being able to capture that and know what you're looking for. We have to know our consumer, and we're able to do that from the data that we get back based on who's, logging in and who's accessing the information. So, what a provider thinks is challenging is totally different than what a consumer thinks is challenging, and is totally different from the pharmacy perspective. So just the public and private perspectives are totally different. So one product trying to design for the use of everybody is challenging. And I don't think we can create a good product without good feedback. So I appreciate it. Sometimes it's kind of hard to really understand, but I think it's helpful and helps our design our products better.
And I think it's interesting to think about the power of insights, right? The data and information that you're getting, but also the power of parallel experiences. So where else is somebody interacting with technology that they're just going to assume that your technology is going to work as easy as fill in the blank of a totally different industry? We've worked with clients in a number of those types of situations. So we've done things like a retail safari where, we'll work with a health system and walk around a spa or walk around a mall, walk around a particular Apple store and how they're doing appointments and reservations, for example, and really get kind of into the mindset of that customer performing a function that is not the same, but to them is parallel. I'm still making an appointment. Why is it so much easier here? Why is it so difficult there? I'm still learning about the product or information I have purchased. Why is it difficult here? So those have been some really, really interesting activities that we've gotten to do as you think about how do you think differently? How do you put yourself in not just the position of your customer in that process that they're going through, but how do you put yourself in that position of that customer as a person? And really think about that and break down that experience. It can be really insightful to understand why they're making some assumptions that you might not expect them to make.
Wow. There's a lot I could say in this, but I'm going to respect the time here, Rebecca. So just at a very, very high level, we rely primarily as a foundation on what we call qual and quant surveys. So we're looking at their qualitative experience, and we're looking for them to score us in a particular area. So we'll do that. We need to do that, I believe, as an organization. We've been doing it every 2-ish years. I think we need to start doing it more frequently because, as I was sharing with some folks earlier, the world is changing underneath us. It seems almost daily. So what we believed, what we thought we knew about our consumer yesterday, pre-COVID, during COVID, now peri-COVID, that consumer is changing. I think what they want, it's not what I think, I know because I'm seeing the data. So we start with the qual quants, and then from there, as Michelle pointed out, we're getting every month PSS scores, so patient satisfaction scores. We also have an online consumer-directed lab test that they can do online, kind of it's an Amazon shopping experience. Each time they interact with us and click that, yes, I want to get this test, we ask them some survey questions, and we get those surveys back monthly. So we're getting it from a couple of different points. But one of the really cool things that we implemented, and this was during COVID, was we reached out to patients who'd opted in to receiving information from Sonora Quest, and we said, would you be willing to be part of our consumer innovation team? Typically, we've had client advisory boards, but we wanted a consumer innovation team. And we thought, we didn't know, what was going to happen. They might have said, we're busy. We've got COVID on our minds. Believe it or not, we had thousands of patients that responded that they wanted to be part of our innovation team, the voice of the customer. So how did we use that? We used them, and we used those folks who were willing to give of their time to ask them how they wanted to be served as parts of the pandemic occurred. So there was the kind of lead-up pandemic, and then we did a lot of work, obviously, to handle all the testing we needed to do here in Arizona. But we started to figure out how do we take testing out to the consumers, right? They didn't want to come in our patient service centers. We understood that. We needed to get access points out. So we asked the consumers, where would you like to get COVID testing done? Would you like it in your home? Would you like it in your doctor's office? Would you like it at your child's school? Would you like it to be at your place of employment? Where would you like to see the testing done, and what's most important to you about that experience? That's real life data that we gathered that allowed us to bring a solution to market, commercialize that solution in a successful way because, again, we're using very recent VOC. So that's our most recent experience.
Some great ideas here today. Safaris, patient experience teams, chatbots. I love it. What is going on with interoperability? I know that in healthcare, this is a huge issue. All of us, it's probably our worst nightmare.
How much time do you have?
So why don't we sum up just with a few thoughts, how you're approaching the challenges there as you try to modernize some systems, but you're stuck with old ones, and some don't talk to each other nicely. Let's start with you, Michelle.
Okay, wow. This is a hard one. The whole interoperability and what is compatible and what is not compatible. Okay, most does not seem to be compatible. But you got to figure out a way, right? So everybody wants something quick. They want it done. The consumer has one whole perspective, but yet you're still dealing with the technology on the other end of things. And so having to really take that, what they're expecting, what we have, and what department you're working with, right? Public, private, consumer, doesn't really matter, and really modify to kind of make it useful for the consumer. And not only that, provide feedback to whoever is asking in what capacity. So very challenging all the way around. I think the legacy part is an extreme challenge, but we will get there. And I think with some of the patients, we've seen some big upticks because with COVID, I think it's forced us really to move a lot faster, which has been good. Mm-hmm. It also provides a lot of challenges as well. So yeah, I think just to keep it brief, that everybody's doing the best that they can, and having that working together is challenging, but also very life learning too. So helps us.
Yeah, I think the collaboration piece is key. Absolutely.
Yeah, it has to be.
I think with any kind of next generation item like that, right, the promise is there, but so are the expectations. Yep. And I think that's really about the balance, right? It's understanding where the promise and where it could get and where it could be, but how people are interpreting that and basing their expectations on just a seamless version. Right. So that's where you hear from your customers. And I don't know. I mean, I thought I could just talk to each other. Isn't this my record? Isn't that yours? How do you not know where I just went to CVS? And I think it's understanding and breaking that down. And then there's the reality of the spend on top of it. Right. So from an investment perspective, from an expectation, and where do you focus that time and energy, and what can you get done to kind of try to get as close to those expectations or retrain them or figure out how you can meet them. I think is difficult with any of the kind of plans and processes within the data interoperability space.
Yeah, I think the only thing I'd add to that is we have our eyes on the CMS interoperability rules, and you can't be an expert in everything, so that's a really good area to kind of go, okay, how can I lean into somebody who may have a much better idea of what that means, not only to Sonora Quest. At the end of the day, I need to think not only about what we need to do to get our own data in a data lake that's accessible, that has longitudinal data, but I need to be thinking about what my payers need, because guess what? They're going to be coming to me saying, hey, we need information about Mrs. O'Leary and what she did on September 17th. So by the way, we need that yesterday. And they're not going to sit and wait for you to set up an interface, get a flat file set up, post it somewhere. I mean, they need it now. And now with CMS's expectations, we need to be thinking about not only what do we need to have ready for our partners today, but what is it that they're going to be looking for in 2022, 2023, and beyond? CMS is looking to whatever they need to do to keep Medicare alive, they're going to do. So they're going to want to make sure they've got everything they need to keep costs down for the Medicare system. And every one of us who's a part of that healthcare ecosystem, we have a responsibility to get them what they need so that they can make payments out to the folks that are actually delivering service. So it is, Rebecca, I think it's one of the biggest challenges and opportunities in front of us today as healthcare community members is how do we get in front of this, and how can we not just think about it as here's the rules, let's follow them and tick them off. What more can we do? What questions government may not be asking that we need to let the government know you need to be asking about this? So there's a lot there, and we don't have enough people, quite frankly, to just focus on that. So I think that's a great area to think about leaning into experts.
Yeah, and I love how you talked about like not just doing the bare minimum, which I think is what sometimes has been done in healthcare and why we end up with such a kludgy set of systems. Yep. But really imagining what the best possible scenario would be and really working toward that bigger vision and collaborating together as an industry to make that happen. So to wrap up, I want to get a few thoughts from each of you on maybe some challenges that you have encountered in this last 18 months that perhaps you didn't expect, and how you address them. So, well, I'm sure there's many, so let's just pick one favorite from each. Do you want to start, Christina?
Do you want a challenge and then a success, or just a challenge?
One of your challenge and how you guys addressed it.
Oh my gosh. come back to me in a second because I'm going to try and keep it brief.
I can start a little bit. I think from ours, it's just been general engagement. I think engagement with clients, engagement with the community, engagement with employees, both new and existing employees, right? Existing employees were very used to how we interacted, how we engaged. We have a very strong culture. A lot of people who have been with the Nerdy organization for an extremely long time. We have a lot of folks joining who expected that culture, and we expected to give it to them. So I think it's really about maximizing the cultural championship with champions within the organization and figuring out how you can nurture the spark of the culture, but try to look and see how we can opportunistically expand it in different ways, as well as now that there's some more opportunities, continue to build back some of the original ways that we did hosting events, having people around, meeting and interacting, as well as we've expanded our population from a localization to a more wider national presence within both our client sets, but also within our nerd population. So we're always going to have this mix now. So the lessons that we learned over the last couple of years, we're able to keep and really push forward into to have kind of more of a hybrid culture of not just in person and in around, but also like how do we build those relationships virtually and keep them and pace them.
Do you want to go next, Michelle?
Sure. Okay, so for us, there's been a whole lot of challenges. But a lot of great learning lessons that have come from it. So we do vaccines, right? And I think the biggest challenge is the applications and the systems have been old within the pharmacies and public health departments. They couldn't withstand the amount of data that the White House was asking them for. So not only are they asking for those things, the vaccines to be submitted and given back to the consumer, well, the systems weren't equipped to handle it. So we've had to upgrade everything, which we all know we needed to do. It's nonstop, but the capacity and the pace that's been asking is a bit challenging. And not only that, we get, we need this tomorrow. Oh, no, and then we do it. And then, oh no, we needed something different. Now we needed this. And just getting a clear direction, I think from the top down, White House, CDC, we have to follow all those. And we do. And, but the pharmacies are a little bit different than the public health departments. And not only that, we have the consumer side of things now, right? So we went from a year ago to having little less than 1 billion consumers. We're now at 2 billion in less than a year. So all those people are trying to get access to the records. Well, if the health department hasn't imported it correctly, you might not get access to your records. So then we get all the consumers calling us saying, why can't we get access to our records? So it's definitely a challenge. It's something that we've had to work very, very quickly on. And everybody has been, mostly the health departments are wiped. A lot of turnover because it's happened at a rapid pace. They're being asked to do things that they've never been asked to do. And so we've had to work a lot with them to be able to kind of work through that, and then how the pharmacies give that information back to us too, so that we can provide that. So I think it's the whole ecosystem as a whole, but I think it really comes down to the systems and the technology that we had been working fine until, we have this explosion, and now we needed something yesterday, so.
So it gives everyone a good reason to upgrade early, not delay.
Yes. Tell that to the health departments.
How many times you put scale at what? Scale 2 times? Scale 10 times? Yeah, exactly.
Rebecca, the only thing I would add, because I completely agree with you, Megan, and with Michelle's comments, is just this agility, this culture of agility. And we have so many folks that have been in their roles, which is a good thing, for decades. And suddenly we're pivoting, literally, not kidding, hourly. We're going to do this. Now we need to do that. And that was a challenge because you had people that are fighting you every step of the way. And it's your responsibility to make this happen. And that's out of scope, and we need 15 documents, and we need CapEx, and we need it tomorrow. So how do you change that? How do you overcome that? It starts at the top, in my opinion. It has to come from the top, and leadership needs to say, you know what? Here's your SOPs, and this is very difficult in a diagnostic environment. Your SOPs are what they are. Now we need to sunset the SOPs, and now we're going to innovate, and we're going to create a new process, and we're going to call it fast track. So maybe we don't need every person in finance to DocuSign this form. Maybe we only need the director because they've been hired in their leadership role, and they should certainly be able to sign off for $50K. So it's really starting that cultural mindset change, and it starts at the top. It really, truly does. And I think it's all of our responsibilities to challenge in our own organizations. If you go through that, okay, you got to do 50 things to get this one thing done. Please help us understand why all these 50 things need to happen. Some of these processes that are in place in our IT systems, they're in place for reasons that no longer exist. And so we need a challenge, and we can do that respectfully.
I love that. Question everything. Well, thank you all so much for being here today. To wrap up, I want one last parting thought from each of you as a just, challenge or wish for our audience here today.
Well, I kind of like what Christine said, to kind of challenge everything. Don't take everything for granted. I mean, understand why you're doing things, but also be forward thinking and bring in those people that encompasses the full spectrum. So while you might see a small part of it, don't be afraid to work with others who may have a specific aspect, because really you go hand in hand and you're only going to help each other. So that would be mine.
And I think don't discount the impact of parallels, right? So parallel situations, parallel processes, parallel experiences. Everybody tends to really focus, especially in these very high pressure, high impact situations, on your slice of your piece of that customer's life and experience. But they are also being asked to be very agile. They're also being asked to, maintain their children at school while they're also trying to look up, each independent. So think about your customer holistically and all of the changes that you've been through and how they felt and how that's going to impact how people might mirror and give you different feedback or expect different things going forward. So it's always think about those parallel paths, those parallel experiences, and how you can tie them into what you're asking the customer to engage with you.
I love that one. Just one thing, what I've noticed in the Arizona market in particular is this is a really unique community here. The competitors of yesterday are the collaborators of today, and I see that alive and well in my interactions across the healthcare ecosystem here in Arizona. So we're all here to help each other out. So my encouragement to you would be to really dig in on your level of confidence. Don't be the last person to speak in a meeting. Be the first person to speak in a meeting, and be confident that, your opinion matters. And then if you need help and you get frustrated in your career with IT, whatever it is, lean into somebody within your ecosystem, share that, get support, and then move on. I mean, we're all here to help one another. I want to help you. You want to help all of us, vice versa. We're here to help each other be successful. And at the end of the day, I'm in healthcare because I want to make a difference for people and their families. That's why I serve the communities. We share that, whether we're competitors or collaborators. So get in touch with your purpose and gather people around you that have that same purpose, and you'll be fine. And thank you for hosting us.
Absolutely. And I think that's a good
you.
example of how we're trying to do that tonight. So
Yes, it's been fun.
thank you, Christina, Megan, Michelle. They're available for questions if you have any follow-up conversation. I think we still have a little bit of time here before they kick us out. So thank you all for coming.
Thank you, guys.